UNHCR is working in three pillars in response to this situation. The first one is prevention, very much at the community side. So we have distributed tens of thousands of units of soap to mostly all refugee families in informal settlements in the Bekaa, together with UNICEF. UNHCR, under the Ministry of Health, coordinates a working group of community health. So we have hundreds of volunteers mobilized, close to 800 volunteers, modern refugees mobilized. So we have been putting together messages on hygiene, on social distances, on all these important measures at the personal level. So for the last 3 weeks, we have been very active on this. We have had 81 sessions with trainers, and then around 200 direct sessions, and then 78 sessions on WhatsApp or Facebook for refugees in the Bekaa. A second pillar is containment. We have a plan for home isolation, because there is a provision that refugees can be the same as Lebanese, can be suspected, and they need to be isolated before we have the capacity to test or to transfer to a hospital. So we have a system that we piloted on Saturday to isolate either one person inside the tent or several persons inside the bigger structure that can be a rock hole, or it can be a building. Several mayors have been actively identifying buildings. Minister of Social Affairs is helping some mayors to identify empty buildings that we can use as isolation facilities, both for Lebanese and for Syrians, and then we help also mayors on this. A third pillar is response. So we have to be aware that there might be hundreds of cases of COVID-19 in the country. Many of them may be refugees. So we're helping the Ministry of Public Health with staffing for the helpline, so that we can have a helpline that helps everybody in the country, including refugees. We're working with several hospitals. The idea is to have, at least in every region, one hospital in which UNHCR is supporting with ramping up the intensive care unit, and then UNHCR will be paying also for all tests for refugees to help. One of the establishing a sort of a parallel system for refugees. Rather, what they're doing is try to help the Ministry of Public Health to bear the burden of the situation, so that they can be the same response for all inhabitants of the country, regardless of nationality.
هلا الخوف اكيد عم نخاف موجود، واهم شيء عم نعمله انه ما عم نعمل تجمعات. عم نحاول كل انسان يضل لوحده بالبيت، يعمل حجر صحي في بيته. ما بيطلع الا على الشغله الضروريه بس. الضروري الخبز، الاكل، الشرب. هذا نحن عندنا قوت يومي، ما عندنا مثلا بنحط اكل جمعه او لشهر. هلا اهم شيء انه واحد يلتزم ببيته. هي لمده المهله اللي اعطونا اياها اسبوع او 15 يوم. المفروض كل واحد يضل ببيته قدر ما يعني.
ممنوع هلا شخص يروح على الدكان يجيب اغراض اكل وشرب وبس. على الشغله الضروريه ايه بنروح على الصيدليه، على السوبر ماركت بس. اجوا نبهوا انه ممنوع التجول، والعالم كلها يعني تغيدت بالقرار، ما حدا يطلع ما حدا يفوت. عم نتعقم بديتول وصابون ديتول، ونكثر من اليانسون، زهورات، نتمخمض بمي وملح. هاي الاجراءات اللي عم ناخذها. اجت البلديه رشت، عقمت الطريق، عقمت حوالينا. الحمد لله هون بالبقاع ما في اصابات. يعني الناس بدها تصبر، شو مرض خطير، مرض يعني مؤذي ومعدي وما حدا يقدر يقاومه، يعني صعب يعني. بس انتشر مشكله، يعني اذا انتشر بعيله شو العيله كلها راحت.